Well, good morning, everyone. How are ya? And welcome to another live this morning. Hope you're having a great start to your day. We always ask that, but I mean it. We really appreciate, and we know some of you get up so early in the morning to watch us live. We appreciate that. We look at Brahim there bright and early this morning from Portland, Oregon, Andrea from Niagara Falls, Lynn from Aurora, and Janice from Brampton, getting right near the top, you guys. Carrie, Nebraska. Lynn Marie, how are you? Madeleine, Kippawa, Quebec, bonjour. Sandy, Fergus Falls, Minnesota. Hi, Sue, how is you? Wendy from Markham. Georgie, Halifax, Nova Scotia. Volita, how are you? Gloria, New York. Frances Marie. Frida, nice to have you on this morning. Gail, how are you, Gail, from Saskatchewan? Nellie, good morning. Diane from LaSalle. Sandy from Chilliwack, British Columbia. Cindy, Saskatchewan, okay, well represented. Elaine, Newfoundland. Doc McHewitt, West Tennessee. Babita, we appreciate you guys coming on. Edith, sunny Halifax. Diane, Thunder Bay, yeah, the sun's out here this morning. We've really had a lot of, what a great week. Denise, Wendy, Wasaga. Nicole, how are you? And Nina and Gary from Bolton. And Milika, good morning to you from Stouffville. Dorothy, Cornwall, PEI. Marianne, London. Francis, Vaughn. And Joanne, Eganville. I know where Eganville is. Friends up in the clouds. Sandy, Vancouver, Washington. Bright and early. Wanda, Virginia. Nativity. Dark and cloudy, she says. Carol, Mount Pearl, Newfoundland. Marlis, Manitoba. Sue, good morning. Heather. Miramichi. Sherry. Darlene, good morning. Eileen, Brampton. Sue is on Manitoulin Island. Beautiful. Rosa. Karen. Peterborough. Yolande. I was waiting on you, Yolande. Sharon. Good morning from Lakefield. Maureen. And Marianne. How are you? Marianne says still got the furnace on. Bonnie. Jean, how are you? Carol. And a couple of more. Elsie, how is you? Karen, we love having you on. Janice from, it says Houston. Is it Houston or Houston? Janice. Crystal and Debbie from Quebec. Bonjour. Sharon is in the cloud. Cheryl. Guys, what happens a lot of times, hi, Lisa Marie and Joan. You go up in the clouds, okay? And I don't see you, okay? Dave, how are you? Sandra, good. Okay, thanks for coming on. Okay, part 3 of a 3-part series, okay, on medications. Now, this one is a love-hate relationship. Okay? I talked about PPIs, proton pump inhibitors, the side effects, dangerous medication. Okay? Prilosec, Nexium, the others. And I told you why. Okay? So I don't have a good relationship with that med, because I've seen the damage of that med. And the longer it's been out, the more they see the side effects of that med. And I understand you got acid reflux. It ain't no fun, but you got to use that drug as a Band-Aid only and then get off of it. You got to fix the acidity in your stomach. Okay, that's one. Then yesterday we talked about another class of medication. And this one I hate, guys, because the whole premise is wrong in my humble opinion. Okay, and that is statin drugs. Crestor, Zocor, Lipitor. I talked to you yesterday about all the side effects. I talked to you about how they look for love in all the wrong places. It hasn't even put a dent into heart disease. So I'm just giving you information, guys. You got to make those decisions. I can't make them for you. Now, today we're going to talk about antibiotics, okay? And what have I said on the Doctors In podcast? What did I say on the Doctors In radio show that I had in the, for 20 years before doing a podcast? And I said this, guys, years and years and years ago when I didn't have a radio show, but I did a lot of media because I wrote books. You write books, you get yourself a publicist and a media person, and you're on TV and radio big time. It's amazing, okay? I used to do a lot of that. And so I've been talking about antibiotics for a long time. Here's my statement. The greatest discovery of the 20th century has become the curse of the 21st. Okay? The curse of the 21st century is an antibiotic. So for me, Dr. Martin, it's a love-hate relationship. Listen, antibiotics have saved millions and millions of people's lives. How can you not love them? But, and again, this is a big but. The problem with antibiotics is that the long term, and people don't realize this, they take an antibiotic for 5 days and it wipes out all your friendly bacteria. And a lot of people, well, the majority of people have been given bad advice when they take an antibiotic. They're not told that they wipe out all their bacteria in 5 days. They're not told that. They should be told that. And the more that we study the microbiome, okay, your bacteria, that, the good and bad guys living in harmony with each other, okay? The more we study that, the more we realize the importance of your microbiome. Now, like I said, I've been preaching this for a lot of years when people didn't understand what I even was talking about. Because here's most people. I took an antibiotic. My pharmacist said, make sure you finish it because that infection might come back. Finish it. But, now they know that that's not right. That was bad advice. Because the antibiotic wipes out your friendly bacteria, all of it. And that makes an enormous problem in our society today. Okay? When you wipe out all the friendly bacteria. And so antibiotics, as much as we love them for saving people's lives, sometimes you have absolutely no choice. But I wrote about this, guys, 30-something years ago when I did my thesis on chronic fatigue syndrome. I talked about the overuse of antibiotics. It was almost invariable with people who got chronic fatigue syndrome. I wrote about it. It wiped out their friendly bacteria, and they got a condition called leaky gut. You should have seen the look. When I used to tell people, you got leaky gut. What? And then they would go to their doctor, and then they would say, Dr. Martin told me I had leaky gut. Now, go back 30 years. Their physicians would go crazy. Leaky gut. No such thing. Okay? And then I used to say, okay, you got a yeast infection. Because when you wipe out your friendly bacteria, you get an invasion of a third army. I call it the Trojan horse. A fungal infection. Now, ladies, you understand this more than anybody else. You take an antibiotic and you get a yeast infection. Happens a lot, right? Common. You get a yeast infection. Down in the privates, okay? Urinary tract or whatever. You get a yeast infection. Oh yeah, I took an antibiotic. But guys, what I talked about years ago is you get a yeast infection and you don't even know it because it's not necessarily giving you any symptoms. It just happens that you get an invasion of fungus. Candida albicans. It gets into your bloodstream. And doctors used to argue about that. Yeast can't get in. If you ever had a fungal infection in your blood, you would die. Yeah, maybe. And you're not going to die right away. Because they're thinking of sepsis. They're thinking you got an infection in your blood. You're going to die. Dr. Martin's crazier than a hoot owl, they used to say. He's crazy, that guy. Why are you listening to him? Okay. But I used to preach it. And of course, I had a radio show. I was on the media. And people would go ask their doctors. Nah. That don't happen. But now we know at 100% that I was right about that. I was right about that. And years ago, I used to tell people, okay, I used to tell the public, when you take an antibiotic, make sure two things. One, you take a probiotic with it. And then afterwards, double it up. One. And secondly, don't finish the antibiotic. Meaning that the second the symptoms disappear, stop it. Because you don't need it anymore. You're just killing all. And guys, here's a real problem that I used to scream about. Okay? You know I got a loud voice, right? I used to scream about this. When dentists said, you're coming in for dental work, you need to take an antibiotic before you get here. Oh! I hated that. Why are you starting the invasion of the Trojan horse before you go see your dentist? And you know now, okay, the FDA, Health Canada, The College of Physicians and Surgeons are telling doctors, you're overusing antibiotics. Hello? It's 2025. Yeah, we're over. Now we got all these superbugs like C. difficile. Go to the hospital. The most dangerous place in the world to go is your local hospital. Okay? It's not Afghanistan. Okay? I don't know. Name a dangerous place that you can think of. Well, it ain't there. It's your hospital. Right? Why? Because it's the home of superbugs, including C. difficile. And what a name they gave it. C. difficile. That's French for difficult. Okay? Très difficult. Why? Well, the bugs develop a resistance. And that's a major problem. That antibiotics don't work like they used to. And we see so much more, okay? I don't know what the stats are exactly. How much more sepsis we see. People get it, they get an infection, then they get sepsis. And they die from it. Or they get, on the verge of death. They go in for a minor operation and it's the overuse of antibiotics. It's the overuse. And I talked about, okay, I'm just going to get a book out so I can show you. Where is it? Take it out in French. Take it out, where is it here? Here they are. I showed you. I think I take them out every week, okay? See that? It's upside down to you, or the writing is, okay? See that guy on the top there? Does that look like me? That don't look like me. Who is this guy? I'm on the back of the book. Okay. That book was written a long time ago on chronic fatigue syndrome. Okay? And here's the French version. Okay? For my Quebecer friends. Okay? Bonjour. Okay? Le syndrome de la fatigue chronique et fibromyalgie. If you read this book, and you'll find out what I talked about in the Trojan horse invading way back then. Because when I did my thesis on chronic fatigue syndrome, we had interviewed over 500 people. And almost invariably, I think it was over 90% of the 500 that had chronic fatigue syndrome, officially diagnosed chronic fatigue. I didn't diagnose it. They were diagnosed by a physician, and reluctantly too. Fibromyalgia, go back in the 80s, late 80s and the 90s. Doctors were very reticent to even give you the diagnosis because a lot of doctors thought it's just women, it's just their hormones, they're just depressed, I used to go on TV and radio and scream because women were falling through the cracks and nobody was taking them seriously, this chronic fatigue and fibromyalgia. And anyway, I talked about the results of our surveys and that over 90%, I think it was 95% of them were on antibiotic treatment before they got chronic fatigue syndrome. Either as children, lots of antibiotics. You've been on lots of antibiotics, Oh yeah, ears, I had sinus infection, acne. You wouldn't believe how many people were given antibiotics for their acne. They still are today. Months and months and months. Oh yeah, but Dr. Martin, it cleared up my skin. I know, but it's a double-edged sword. It wiped out all your bacteria. You weren't told that. And then what we found is there was a huge connection years later, not only to chronic fatigue and fibromyalgia, almost every autoimmune disease. Why do we see so much autoimmune today? I'll give you 3 guesses and the first 2 don't count. Why do we see so much autoimmune today? The double-edged sword of antibiotics are one of the main culprits of that. And nobody talks about it. I brought to you, because today you hear about ivermectin, right? Because I hear about it every day. Dr. Martin, ivermectin. What about this? Should I take it? A friend's got cancer. Should they take ivermectin? And well, I'm almost calling it a designer drug because it becomes so popular. And I'm not against it. I told you that the other day. Okay? I told you that the other day. But it's because the theory is that all cancers are parasitical. And I've seen it on the internet and whatever, and YouTube, and they're talking about it, and it's all, but go back 40 years ago, I was telling you, it ain't parasites, although parasites might be involved. It's leaky gut. And you get the invasion of the Trojan horse, which is yeast. It's fungal. And I was in Dallas, Texas, ready to go on a TV show. This was years ago. And I had written another book. And this guy, Dr. Simoninski, it was Simoninski from Italy, was saying all cancer are fungal. They're yeast. Okay? Boy, I was shocked there was someone saying it. So guys, am I saying don't take an antibiotic? No, I'm not saying that. Okay? I'm not. As a matter of fact, over the years when I was in practice, people would call me up because they were my patients or whatever. Doc, I got a bladder infection. Should I take an antibiotic? Is it burning? Yeah. Well, take an antibiotic for a couple of days. Make sure you're taking your probiotics. Make sure you're taking oil of oregano. And when the symptoms go away, when the burning goes away, stop. Anyway, I got a lot of pushback on that. Okay? But back to leaky gut for a minute. Okay, because I almost every day I do some form of talking about leaky gut, where the microscopic lining of your gut, the barrier that's there between your gut and your blood should be pristine. The life of the flesh is in the blood. Your blood, no life. Right? Of course. You need your blood to be pristine. And you have barriers to protect. You've got the blood-brain barrier, microbiome. You've got your gut blood barrier, microbiome. And as long as you got as many friendly guys as you have bad guys, it's called you win. I call it the invisible war. You guys know that. Every book I write, I talk about leaky gut. Every book. I've never gone through a book that I haven't talked about leaky gut. Okay? From my first book that I ever wrote, Leaky Gut. When people weren't talking about probiotics, I was talking about friendly bacteria. And I'm sorry. You love yogurt? I love dairy. Okay? Dairy farmers, you owe me. You owe me because I'm your biggest fan. I love dairy. Now, don't drink milk unless you got one of those cows in the backyard. But I like yogurt. But you don't take yogurt for friendly bacteria. Yeah. One little capsule of probiotic. You'd have to eat 16,000 yogurts, 4-ounce yogurts. And most yogurts, they flavor them. They put sugar in them. I can't stand it. Leave it to the food industry. Oh yeah, but Dr. Martin, yogurts kind of tastes like sour, you know. Yeah. But it's good for you. I love dairy. You guys know that. Anyway. So, what's the moral of the story? Antibiotics, the double-edged sword. The biggest factor is leaky gut. Leaky gut, you get a fungal infection, you can get leaky sinuses. The yeast can get into your brain. And remember, fungus and yeast is a carrier. It loves to carry things like lead and mercury and cadmium and aluminum into the brain. It carries it. And if you don't have enough friendly bacteria, it'll get across the blood-brain barrier. And why do we see so much today? Autism. Why? It's incredible, guys. They're talking about in California, what is it, 1 out of 20 or what? But I'm a why guy. Why is that happening today? Why are these kids the canaries in the coal mine? And I'm not saying it's the only factor, but it's a major factor. It's fungal. How did that happen? Mommy was on antibiotics. Baby gets on antibiotics. They're not taking the probiotics to fix the dysbiosis. It's a big issue today. Okay? It's leaky gut, leaky brain. Why do we see so much Parkinson's today? Why do we see, in my opinion, why do we see so much ALS like Lou Gehrig's? Why do we see so much MS? Other than a lack of vitamin D. Usually goes with it. Why do we see so much of it? Why did I see that epidemic of chronic fatigue syndrome? It was like a perfect storm for these people. But one of the main things was antibiotics. People on antibiotics for years sometimes. And doctors, they meant well. Right? I just don't want you to get an infection. Okay. I remember, okay, and I get on tangents, but I got to say it anyway, okay? There was an antibiotic that drove me crazy. It was called Cipro. It was in a classification of antibiotics, and they were given out like candy to women, especially urinary tract, some men for prostatitis, an infection of the prostate. But women, they were taking this stuff like candy for urinary tract infections. And that gave me a migraine. I said, you know what? There ought to be a black box warning against that medication. I said, they can use other antibiotics, but it's stubborn, so we got to use Cipro. Ooh. You know how many times I saw people in my office with the side effects of Cipro years later? Blood cancers. Years later. I used to ask the question, were you ever on Cipro? Okay. Severe autoimmune. Severe tendinitis. And joint with, almost unexplained. I used to see it with Cipro. You know what? They finally put a black box warning on those that type of medication, but they're still using it. They're still using it when they can use something safer. Oh yeah, but this one worked. Yeah, but it killed. You got rid of the infection, but it killed you. You died of something else. Oh, anyway, don't get me going. Don't get me going on that. Okay. So, okay. Again, make sure you don't misunderstand what I'm saying. Okay? Please. Okay? If you need an antibiotic, you take an antibiotic. You hear me? So don't go say, Dr. Martin told me not to take it. I never said that. And listen, it's hard for me because I'm not in practice anymore. So for me to say, stop your antibiotic when the symptoms, that is just giving my opinion on a general classification of a medication. But research has shown that, by the way. Better to stop that medication when the symptoms disappear. Anyway, you got to discuss that with your physician and your pharmacist, okay? I just got to put that out there because, I don't want to be known for giving personal advice when I'm not your physician. I'm giving you educational advice. So make sure you understand that, right? Okay? Just make sure you understand that. Guys, I'm on your side, by the way. Okay? Sometimes people think, well, geez, you're picking on me. Well, I said, I'm on your side. I love my audience. I'm just trying to give information. And by the way, in case you didn't ever know this, I'm very opinionated. I've got strong convictions. And again, on antibiotics, it's not like I haven't said it before. I didn't just make this up. I've been warning people. I've been warning the world that would listen. We got a problem, Houston, here. We're overusing these things. And people are not replacing their bacteria. And yeah, there's no light on the top of your head that goes off and say, you're short, you don't have enough friendly bacteria. And people don't know anything about it. And nobody tells them anything about it. Now, my audience, we know better. But the world out there, they don't know any better. And the antibiotics are in the soil. They're in the food. They give it to the animals. They overdo it. You got to take care of yourself. There isn't anyone here listening, not one person listening. Even your dog. Is your dog listening? They need probiotic. You need probiotic. The world in which we live, you need a probiotic. And it should be broad spectrum with many different bacteria, because you got to replace. They wipe out all your good ones. You got to replace that. Okay? And I didn't even talk to you about other things that destroy your friendly bacteria. Okay. I took a deep breath. Okay, so those were the 3 classifications of meds that Dr. Martin is warning about. Okay? A warning. PPIs, proton pump inhibitors. Okay? And the side effects are severe down the road. Statin drugs for cholesterol and antibiotics, okay? They're that little trinity that I'm warning, giving you info. Okay. Now what's tomorrow? Q&A. Okay? Q&A. Who doesn't love Q&A? Okay? People love Q&A. I like Q&A. I'm used to Q&A. I had a radio show. People would phone in Q&A. Dr. Martin, what about this? Okay? What about that? What about this? What about that? And it was always popular. People liked it. People are very interested in their health today compared to what it used to be. Before it was, well, whatever my doctor says. Whatever my doctor says. Okay? My doctor says nutrition ain't important. Well, your doctor's crazy. And you can tell him I said so. Okay. No, people are very interested today. Send in your questions send it to info@martinclinic.com. That gets to me. Okay. We love you. Talk to you soon.